This week on Top Stories in Health, fake Ozempic vials spark urgent warnings, routine checkups lead to shocking hospital bills, the CDC slashes sickle cell support programs, Medicaid confusion deepens across the U.S., and a dental habit linked to better aging. Let's break it down. A major warning from Novo Nordisk and the FDA this week. Counterfeit versions of Ozempic are circulating in the U.S., with at least 5 people reporting adverse reactions. The fakes are so convincing, even healthcare providers may not catch them. They mimic real packaging and contain the same active ingredient, semaglutide, but in dangerously unregulated dosages. Investigators traced some of the supply chain to a legitimate U.S. distributor that had unknowingly received tainted products. With Ozempic in high demand for both diabetes and off-label weight loss use, the black market is thriving. And so are the risks. Meanwhile, millions of Americans are getting hit with surprise hospital fees for what used to be basic care. The issue? More outpatient clinics are now owned by hospitals, and that changes the billing rules. When you visit what looks like a regular doctor's office, you might be charged an extra facility fee, even if your appointment is short and straightforward. Some patients shared stories of receiving unexpected bills for over $300 simply for checking in at the front desk of a hospital-affiliated clinic. Experts and consumer advocates are pushing for transparency, arguing that patients deserve to know upfront what they'll be charged and why. There's also growing concern over the CDC's decision to cut support for adults with sickle cell disease in 10 states. These programs were part of a broader effort to help patients navigate disability benefits, connect with care coordinators, and get access to essential services. Without them, thousands could lose their only point of support. Sickle cell disease is a painful, chronic condition that disproportionately affects Black Americans, and many already struggle with access to care. Advocates say ending these programs could deepen health disparities and force vulnerable patients to navigate an already complex system alone. At the same time, the nation's Medicaid safety net is fraying, and many people don't even know it. According to new reports, 1 in 5 Americans is currently on Medicaid. But following the pandemic-era enrollment expansion, millions are now being disenrolled, often without realizing they were even covered in the first place. In states like Arkansas and Florida, families have reported losing coverage for themselves or their children due to paperwork errors or a lack of communication. On top of that, budget cuts are slashing long-term care services, leaving family caregivers to pick up the slack. Many are burned out, unsupported, and uncertain where to turn. To close things out, here's a surprisingly simple tip from the world of longevity science. Floss your teeth. Seriously, new research links consistent oral hygiene to lower levels of systemic inflammation, healthier arteries, and even longer lifespan. Chronic inflammation has been tied to everything from cardiovascular disease to cognitive decline. By preventing gum disease and maintaining a healthy oral microbiome, flossing may play a bigger role in your overall health than you think. Just one more reason to keep that dental routine consistent. Thanks for tuning in to Top Stories in Health. For more trusted updates, expert-curated insights, and wellness news, subscribe and visit healthpost360.com.